Good afternoon, everyone.
Good afternoon.
And I am happy to say that the one who's going to conduct it is one of the best doctors in the world that I have ever met. What makes him a very good doctor is that the things that he does and tells you to do works. And it's natural. So it's a great deal of pleasure that I want to read to you the credentials of Dr. Robin Navarro. He obtained his medical degree from Far Eastern University. He was a research fellow in pulmonology. He received the award of Doctor of Medicine, honoris causa, in Oxford College of Applied Science from Wolfson College, Oxford, England in 1996. He has gotten an outstanding Research Fellow Award by Newton Hall Foundation, Oxford, England in August 28, the year 2000. Dr. Navarro is a most sought-after resource speaker in different events, symposiums, seminars, and convention. And I am happy to say he is one of our very active PCAM members. I am really pleased and honored to introduce Dr. Robin Navarro.
Thank you, sir, for the fine introduction. I would say I also learned a lot from his lecture, especially the use of liver. And I use that for all my patients, not only for cancer, for all patients, they're got to take liver. To the organizer of this symposium, the president of PICAM, Dr. Austria, and officers and members, especially the chairman, Dr. Beth Picalier, to all of you, ladies and gentlemen, good afternoon.
Good afternoon.
Maybe we start with what the Lord said. Deuteronomy 11, verse 9. His instruction to the Israelites is so that you may live long in the land that I am going to give you to possess, a land flowing with milk and honey. So that is a key to the management of all diseases. Long life for those who drink a lot of milk and eat honey. And another thing, in Luke 11, 11 to 13, it says there, you know how to give good gifts to your children. If your son asks for an egg, are you going to give him a scorpion? So the implication is that the Lord is saying, if you don't give egg to them, they will be as if they were bitten by a scorpion. And you see what will happen to you if you are bitten by a scorpion. All right? So listen carefully, because everything that I will tell you is exactly the opposite of what you have heard before throughout the world. Okay. By the way, besides me, is the co-author of this work. I would say she's the author. I'm the co-author already, because she does a great deal of work. Well, they say that behind a successful husband is an overworked wife. Dr. Litz Navarro, please stand. Okay. Sa palagay ko po, baka hindi pa po nakakatulog. Habang natutulog ako, siya nagtatrabaho. Okay. So this is a continuation of what I discussed last week, now about cancer. And then I will talk about heart attack and stroke, still prevention and treatment of heart attack, stroke, and cancer. We are plagued by rapid aging process. Mabilis po tayong tumanda. Okay? Degenerative diseases. I'm already 63 years old. Alam ko kung gano'ng katanda na ako. Okay? But I can beat an elevator up to 12 story. Okay? Infectious diseases. Right now we have A, H1N1, AIDS, dengue, leptospirosis, killing a lot of people, right? Okay? Because you're not giving them milk and egg. That's important, right? Hepatitis, TB, pneumonia. And iatrogenic reactions caused by deaths or diseases induced in a patient by your physician. Okay? So what is the cause of all these things? Is it because of lowered resistance? Is it because of rapid tissue degeneration? Is it because of lack of technology? Or is it because of lack of wisdom? If so, why? Do we have to cut down on nutritious foods like eggs, milk, dairy products, red meat, etc.? You hear that from the radio, right? Be careful about red meat, be careful about milk and egg. Do we need to drastically lower our blood cholesterol level? You always hear that. Do we need to undergo all the modern diagnostic procedures and subject ourselves to vaccinations and or immunizations prescribed to be spared from this plague? Okay? So let's start with hypertension. The hypertension is the major cause of heart attack and stroke. So it's best that we understand this. Okay, let's see the definition. Okay, over here, definitions of the hypertension. You could see classifications. Okay, from normal to stage 1, 2, and 3. Okay, we don't deal with this anymore in details because everybody knows that, right? Okay, what is normal? Okay, this is what we call the writing group of the American Society of Hypertension. This is the JNC, Joint National Committee. Okay, now this is their normal. They don't quite agree. The JNC7 has different normals, and the writing group has a different normal. Basically, it's still considered normal if your blood pressure is 130 and below. Okay, range should be 130 to 139. It should be below 85, diastolic pressure, and range of 85 to 89. Okay, we don't tackle this much. We will move to the severe hypertension over here. Okay, stage 3, greater than 180 systolic and greater than 110 diastolic blood pressure, because this is the blood pressure that kills a lot of people. So we move there. Severe hypertension, systolic BP up to 240, and diastolic BP up greater than 120 millimeter. Classification: accelerated hypertension without sign of end organ renal damage, such as renal failure. So, okay, you have the high blood pressure, but no damage yet. Hypertensive emergency with end organ damage, but absence of raised intracranial pressure. You're still normal, okay? But you have already damage inside. Malignant with increased intracranial pressure leading to severe headache, blurring of vision, and vomiting. Sign, papilledema, okay? Visible on ophthalmoscope by examination of the retina. Okay. Next slide. Hypertension causes the weakened areas in the blood vessels to burst, leading to the leakage of blood into the brain, resulting to hemorrhagic stroke. It also leads to plaque buildup in the arteries, or a blood clot can cause narrowing of arteries and thereby partially shutting off blood supply, resulting to brain or heart ischemia. Ischemia means lack of oxygen supply. When the blood supply is completely blocked, okay, hypotension itong isang aking ano. So this is no way. When the blood supply is completely blocked, tissues will be deprived of oxygen, rich blood and nutrients, and the result is either a stroke or a heart attack. Next. Hypertension-induced target organ damage. First, greater severity and prevalence of end-stage renal disease, requiring dialysis or transplantation. Whichever is, it's too expensive. Okay? Hypertensive retinopathy leading to blindness. That is in the retina of the eyes. And systolic dysfunction and hypertensive heart failure, or what we call cardiomyopathy, weakening of the heart muscle, and or sudden cardiac death due to hypertensive acute pulmonary edema with arrhythmia. When the heart begins to pump abnormally, it is not pumping out blood. So the blood in the lungs, you get the pulmonary hypertension, and the result is pulmonary edema and even death.